claim to believe in the freedom of our nation should consider themselves hypocrites if they also agree with national health insurance. National health insurance is a moral imposition on the freedoms of physicians, healthcare workers, and patients. It imposes on the free rights of small business owners, such as insurance companies, and will lead to a government-controlled healthcare system. This is due to its expense, its control over small business, and the divide it brings between patients and doctors. Whether it is a medical emergency or having your first child, every one of us will someday need health care. I am 19 years old, and I worry that I will raise a family in a nation where a government may keep me from visiting the doctor because of my inability to pay for health insurance. Morally, this national health insurance is a negative decision for America. In this country, doctors have always been allowed the freedom of opening a private practice, able to offer the services of which they choose within their scope of practice. Under national health reform, this will not be the case. Doctors will be encouraged to work as a team rather than alone in a private practice. National insurance separates patients from their doctors. Government-controlled health care would lead to a decrease in patient flexibility. Those literally unable to buy and pay for health insurance will not go to the doctor for fear of the penalty of not maintaining health insurance. Sure, the government says that individuals below the poverty line will not be required to buy and pay for health insurance. So what about the middle-class Americans? If a middle-class American has $1,000 left after taxes are paid, house payments are made, and groceries are bought for their family each month, can that individual really afford to spend $500 of that on health care insurance each month? Not exactly. What the government portrays as affordable on paper will prove to be detrimental to the citizens of our country. Should families be forced to buy health insurance rather than send one of their children to college? I think not. That is not the freedom our nation was founded on. Government-mandated procedures will lead to less physician flexibility, according to healthcare.gov. The government mandating healthcare workers to offer and perform procedures such as abortions will lead to poor working conditions and poor patient care. It is likely government will impose taxes on unhealthy choices. While things like smoking and eating unhealthy foods are not good for any one of us, it is our American choice to eat hamburgers and french fries and smoke cigarettes, if we so choose, without being taxed by the federal government. Then what happens to businesses like McDonald's and tobacco industries that make this state famous? If people choose not to eat McDonald's hamburgers and french fries or smoke and buy cigarettes anymore, it will have an extremely devastating impact on such small businesses. National health insurance is expensive. Too expensive for middle and low-class Americans to maintain. It is so expensive, in fact, that the middle class and the wealthy will have to subsidize this cost for low-income families. Is that fair to the middle class or the wealthy? Doesn't that sound to you like a penalty for doing well? Every citizen will be required to buy medical insurance. This includes everyone, except, of course, for the people below the poverty line. What about the middle class? Should families have to make decisions such as, do I pay my insurance bill this month or do I buy groceries this week? That is what the case will be for countless Americans. According to a poll conducted by the CDC, 21.3% of Americans were uninsured in 2011. 21% of America will be forced to buy health insurance. Before this law came to pass, uninsured people did have access to health care through organizations set up for uninsured people, rather than what we are led to believe. It is illegal to turn down emergency service due to lack of insurance. What we will experience as a nation because of this healthcare law will lead us to destruction. National insurance allows governments to be larger and more powerful than small business. In the years to come, we will see the government become more and more powerful. Eventually, healthcare services, drugs, and medical equipment will be overseen by the government. Government will determine who receives what drugs, equipment, and healthcare services. Doesn't that seem a little scary to you? Government-controlled health insurance will limit competition among health insurance companies. This loss of competition among insurance companies will lead to many of these businesses closing. Government will have control over what treatments are available and to whom they are available. Is this sounding like a nation in which you'd be proud to live in? Do you really want your federal government leaders in charge of your health care? I highly doubt it. In conclusion, the national insurance we have adopted as a nation is not what we need in America. It will have a negative effect on the patient-doctor relationship. It is extremely costly, and it dampens small business. The institution of national health insurance is a moral imposition on the freedoms of our healthcare workers, small business owners, and every person in America who will ever need health care. In the last 4 years, the hands that operate our federal government have led us to higher rates of poverty, more instances of unemployment, and more of our society on welfare. Do we really want to put our health, our livelihood, and our fighting chance at life into these same hands?